Hi, I'm Olivia. I'm the brown armadillo.
I'm Jess, I'm the green armadillo.
I'm Lauren, I'm the pink armadillo.
I'm Brianna, and I'm the blue armadillo.
And we did our presentation on leprosy. My friends think they might have leprosy. I wonder if I have it too. What exactly is it?
Leprosy's proper name is Hansen's disease. It's an infection caused by Mycobacterium leprae, a relative of tuberculosis. It affects nerves, skin, eyes, and nasal mucosa. The misconception is that it spreads easily, but it does not. It can cause affected skin areas to change color, become lighter or darker, and can cause nerve damage, leading to more symptoms.
How is it transmitted?
It's not exactly known how it spreads between humans, but it's perceived to be from prolonged close contact over a month's time with someone with untreated leprosy over many months. Scientists currently believe transmission occurs when a healthy person breathes in droplets containing the bacteria after an infected person coughs or sneezes. It's not spread from casual contact with a person who has the infection, such as shaking hands or hugging. It is also not spread through sexual contact or from mom to baby. It's a slow-growing bacteria, so it's hard to find the source of infection. Fun fact, armadillos are naturally infected with the bacteria, and therefore it's recommended to avoid contact with armadillos, although transmission is unlikely.
Well, that makes a lot of sense. Who's at risk for leprosy?
It's shocking, but 95% of humans have a natural immunity to the disease. You can be at risk if you're around someone untreated, but as soon as a person starts treatment, they are no longer contagious. People who live in countries where the disease is widespread could be at risk, such as countries in Africa, Asia, and the Americas.
How does leprosy occur?
Leprosy is caused by acid-fast Bacillus Mycobacterium leprae. The bacteria divides very slowly, once every 13 days, and its incubation period is 3 to 10 years. It is an obligate intracellular pathogen. It lacks several genes needed for independent survival. Macrophages phagocytize the bacteria but are unable to digest it. The bacteria multiply inside the macrophage and use it as a method of transport throughout the body. Fun fact is it's never been grown in bacteriologic media, but has been grown in mouse footpads.
What are the effects on the body or the symptoms of leprosy?
So symptoms from the disease include discolored patches of skin, growths on the skin, thick, dry skin, painless ulcers on the soles of feet, lumps on the face or earlobes, loss of eyebrows and or eyelashes, and then stuffy nose with nosebleeds. So symptoms from nerve damage include numbness of affected areas of skin, muscle weakness or paralysis, mainly in the hands and feet, enlarged nerves, eye problems, possibly blindness, and a burning sensation in the skin.
Wow, that's a lot of symptoms. Are there any more?
So if left untreated, paralysis can occur, crippling of hands and feet, shortening of toes, fingers, reabsorption, chronic non-healing ulcers on soles of feet, nose disfigurement. And then a disclaimer is that since it affects the nerves, more serious injuries can occur from loss of feeling and no pain. An example of this is if you get a serious cut or burn, it can result in an infection and cause tissue death.
What is the diagnosis for leprosy?
So leprosy is diagnosed by discolored patches on the skin. To confirm the presence of the disease, a biopsy must be done, or the nerve is taken and observed under a microscope to look for the bacteria. Acid-fast stains are used using 5% sulfuric acid. Then a Zeal-Nielsen stain and modified Zeal-Nielsen stain, known as the wide fight stain, is used. So if treated and treatment is completed, the disease can be cured. If left untreated, nerve damage will worsen. The earlier it is diagnosed, the better. Patients can be classified into 3 groups, including paucibacillary, multibacillary, or borderline.
I think I heard of these groups before. The paucibacillary is characterized by one or few discolored skin patches that exhibit loss of sensation, the swelling of peripheral nerves, which can be palpated under the skin, and the most common nerves include the great auricular nerve, the ulnar nerve, the median nerve at the wrist, the radial nerve, the common peroneal nerve, the posterior tibial nerve, and the sural nerve. This is an example of a patient with paucibacillary Hansen's disease. You can see that a large lesion is on the man's left chest, which is attributed to the paucibacillary. For the multibacillary type, it is characterized by a generalized or diffuse involvement of the skin, thickening of peripheral nerves, and can involve other organs. It can affect the eyes, the nose, the testes, and bone. Ulcerated nodules contain large numbers of bacteria packed in macrophages. There can be multiple skin lesions and a thickened dermis. Nodules and plaques are present, and there could be nasal congestion and epistaxis, which are nosebleeds. This is an example of a patient with multibacillary Hansen's disease. You can see that the face of the male patient has many of the pathological characteristics of this type of the disease. The last type is borderline Hansen's disease. This is the most common form, probably what my friends have. It results in intermediate severity, skin lesions like tuberculoid type, but there's more of them, and peripheral nerves are affected. And this is an example of a patient with borderline Hansen disease. Does anyone know what the treatments are for leprosy?
I do. If treated with antibiotics, you can do 2 or more at the same time. Dapazone, which is daily, rifamycin, which is monthly. Sometimes clofazimine, which is daily, and that can be added in for some types of the disease. Multi-drug therapy is used to prevent antibiotic resistance. Treatment lasts 1 or 2 years, and treatment kills the bacteria, but does not reverse the nerve damage. About 1/4 of patients can experience reactive episodes during treatment.
Wow, what are reactive episodes?
Reactive episodes aren't caused by antibiotics. Although patients treated with clofazimine tend to have fewer episodes, 3 groups of reactions can occur: type 1, type 2, and Leprosy phenomenon. Type 1 is the reversal reactions, and this is with typical tuberculoid and borderline. It shows up as edema, which is swelling in the tissues, and erythema, which is a redness of pre-existing lesions. Type 2 is erythema nodosum leprosum, which is typical in lepromatous. This shows up as painful erythematous nodules distributed between pre-existing lesions, and moderate to high fever. Inflammation of other tissues may also be present. Leprosy phenomenon is very rare. However, it's usually seen in patients with diffuse lepromatous leprosy of Mexican descent. This shows up as multiple hard to heal ulcers.
Is there any new research being done on leprosy?
There are. So clinical trials such as drugs like ofloxacin, myocycline, and chloramycin have shown very promising anti-leprosy activity. Drugs are the main area of research for leprosy, as well as research for diagnosis for the detection of early cases, relapses, drug resistance, and viability of the M. leprae. A new vaccine for leprosy is currently being tested, but since the bacteria has such a long incubation period, testing for a vaccine is challenging. The BCG vaccine, which is used for tuberculosis, has sometimes been found effective.
Wow, that's pretty cool. I really learned a lot about leprosy today.
Yeah, I think you might want to go get tested. You kind of look like you have some of the symptoms.
I
Those skin lesions.
probably should do that.
Good thing we just met you, because then we would all have it.
I think you should go get tested too. We can go together.
Okay.
You just have to wear a mask.